Hello, this is Corey DeRinkett. We are going to talk about the decontamination portion. Most part we're going to talk about is the point of use treatment and transport. Um, this is wherever the instrumentation is coming from, they have to use their time to their due diligence to start the cleaning process. So decontamination begins the moment the instruments are used. So up in the operating room, your scrub technician should be wiping the instruments down, flushing those lumens during the operation. So the point of use of treatment is essential to prevent blood and tissue from drying, which makes cleaning more difficult. When the blood and tissue starts dry, it is more time consuming because you've got to soak it, you got to scrub it. Think about the egg yolk that's left on your dish after you fry an egg, after you eat an egg. There's that yolk. If you don't clean it right away, it starts drying. When you start cleaning that dish, how hard is it to get that yolk off of that plate? You're scrubbing it, you're soaking it. Same way with blood. It starts drying, it's going to be harder to clean off. Um, when you're dealing with soil contaminated instruments, you should wear your appropriate PPE when handling any used instrumentation or equipment. The proper transport protocols are equally important. We got to make sure we transport these instruments safely, and they should be in a leak-proof container, and to move carefully to prevent any injury and contamination. So we got to make sure we have a good enough container to where nothing's going to slip out. Make sure it's in the enclosed cart. Following these practices will preserve the instrument facility, and protects both the staff and the patient. Point of use treatment refers to the initial cleaning and care applied to instruments immediately after use in the procedure room. That procedure room can be anywhere in the hospital. 99% of the time, it is in the operating room. But most hospitals have an ER. Most hospitals have a labor and delivery. So wherever it's coming from, the cleaning includes the rinsing, the wiping, placing instruments in a holding solution to prevent drying of organic material. There's sprays out there that they can spray onto the instruments to keep those instruments moist. I can't think of the name of the spray. It's out there, but I've heard that the spray holds up to 72 hours to keep it moist. Remember, when we get it from the OR, we don't know how long it's going to sit until we can get to it to start cleaning. Plus, sometimes the OR holds those instruments up there until they have enough carts to send down. So it could be an hour before they're even sent down. So we don't want to keep the organic material too dry. The treatment at the point of use is critical because dried blood and tissue can make sub, subsequent cleaning and sterilization more difficult. Proper transport ensures that instruments are safely contained and reduces the likelihood of injury to staff and the contamination of the environment. Plus, we also want to make sure the patients are safe too when we are transporting this. Point of use protocols. Remember, this is part of the instrument's IFU. So it's not us telling them they have to do it. It's the instrumentation manufacturer telling the point of use people, this is what you have to do. It is essential for maintaining the integrity and the lifespan of surgical instruments. Corrosion, staining, mechanical damage are often linked to the delays or improper handling after use. Implementing consistent point of use aligns with regulatory and accredited standards, contributing to the overall patient safety and the efficiency in the sterile processing workflow. Contaminated items can enter the sterile processing workflow from multiple sources. Like I said before, operating room is our primary source. About 99% of our stuff comes from the operating room. Uh, they are directly exposed to the blood and tissue there. Any patient care areas, ICU, emergency rooms, um, um, labor and delivery, any clinical that your facility has, that they're the point of use. So they contribute to um, items that may be exposed to any bodily fluids, fluids or pathogens. Laboratories can also generate contaminated instruments and glassware that must be handled carefully. I was in a place that we handled the laboratory stuff. So it's not uncommon for us to handle their stuff as well. Environmental sources such as dust, airborne particles that can carry microorganisms that can contaminate items if not managed properly. Uh, Remember, transport and delivery are critical points. So items move improperly between departments and to SBT can become contaminated. So we need to make sure we have the proper protocols in the contaminant and the handling portion of what we do. So understanding this helps us to implement effective decontamination and infection prevention measures. The decontamination area is ideal. It should be ideally located close to the operating room. This is where most of the soil surgical items are originated. Um, can, it's not unlikely that we are right next door to the operating room, but most likely we are 2 floors down. Any contaminated instruments, equipment, and utensils are transported safely using enclosed carts. Make sure the carts are closed or you can cover the whole cart. Um, if we are on another floor, which most likely we are, there should be a dedicated elevator that is used exclusively for contaminated items coming from mainly the OR down to central processing. Um, Transporting contaminated items between facilities, we will use vehicles. Remember, we have to contact the DOT to make sure we are doing it correctly. Any items that are being returned to the decontamination area can be done on a scheduled pickup rounds. So we would schedule a pickup time. Usually maybe twice a day, one in the morning and one in the afternoon. So first shift we'll have to pick it up in the morning, and ideally second shift will take what was done on first shift back up and also pick up what was used throughout that day as well. They can also request. It can also be a request from the user department. User department. They might not have instrumentation maybe once a week or whatever, so they might just call down and say, "Hey, we got some dirty instruments. You mind come and picking it up?" That's fine. Um, or it can be delivered directly to us from the department itself. So they have to send their staff down to us to drop it off. Once it's in the decontamination area, items are placed in the designated holding area until picked up by either the technicians or the department staff brings it down. When departments are using reusable medical items, it's critical that they have a designated holding area for contaminated items before they are returned to sterile processing. They have to make sure that they are clearly marked with biohazard signage and secure so that visitors and unauthorized staff cannot access them. We don't want those instruments to be handled by people that don't need to be handling them. The proper setup of the holding area is essential in infection control. It should it should include any of the contaminated trash and linen receptacles, any sharp containers. There should be a sink to where we can wash our hands, and also they should have some PPE along in that holding area too. If there is a tray that you're picking up or instrumentation that you're picking up, it still has any trash or linen or sharps, dispose of it at the floor. Don't bring it down to us. Leave it there. Um, Most of the times they will try to have PPE, which would mainly be gloves. If not, have gloves on your cart for you to use as well. Remember, you will change your gloves at every point of pickup throughout the facility that you're working at. Point of use treatment is the initial care given to instruments immediately after use. Its main purpose is to prevent the blood, the soil, and any other bioburden from drying on the instruments, which can make cleaning more difficult and less effective. The more time that we are in the decontam cleaning these instruments, we're taking up valuable time for it not to be processed for the next patient. So the point of use is critical. So we're not spending a lot of time trying to clean these instruments. I've been in places to where it's come down. It's so dried up with blood. I have to soak it, and sometimes soaking it will take up to a half hour just so I can manipulate these instruments. So I'm holding that up for a half hour, and it might be have to be used on the next patient. They're not going to get it in time because it was the blood was dried. It also reduces the risk of any microbial growth and contamination. It also will prevent residues from drying. It will minimize the corrosion and the potential damage to the delicate instruments. Remember, these instruments are not cheap. Most of them are not cheap. Some range in the hundreds to thousands of dollars. So the more delicate, the more money it's going to cost. So we don't want all that damage to start corroding these instruments. Um, the um, it also improves efficiency in the decontamination areas because instruments are easier to clean and to sterilize. So it supports the overall workflow of the sterile processing. It also ensures that instruments are treated at the point of use is a critical step in maintaining both safety and quality standards. Like I said, this is coming from the manufacturers of the instruments. This is there in their IFU stating point of use cleaning is critical. Um, any microbial loads that we're going to be talking about is the treating instruments at the point of use helps lower the number of microorganisms before instruments are transported to the SPD. Um, Remember also microbiology in chapter 4. Microbes, if it's at the opportune temperature and the critical the opportune time for it to start grading. Remember, some of this stuff can start multiplying every 20 minutes, so we got to make sure we we keep the microorganisms down. Um, Prevents drying. We don't want that blood, that tissue, like I said before, anything to harden as it is. If it's not addressed quickly, it makes cleaning harder and it increases the infection risk. Minimizes corrosions. It helps protect the delicate instruments from rust and corrosion caused by dried instruments. Once that blood starts drying onto our instruments, it will start eating at the instruments. That's where you get that pitting on the instrumentation. That's that blood. It's eating away at our instruments. Um, the facility's cleaning. So proper pre-treatment ensures that instruments are easier to clean, and it reduces the likelihood of residual bioburden remaining, especially in the lumens and in the crevices of the instrumentation. Um, holding Handling instruments properly and safely reduces exposure to potential infectious materials and enhancing staff safety. Remember, we got to handle these things, these instruments, with care. Regulatory compliance. Following the point of use treatment guidelines ensures adherence to standards from organizations such as AMI, the CDC, and OSHA. So it's not just Central Supply saying, hey, this is what you have to do. It's coming from a lot of different sources. Uh, Timely removal of contaminated instruments. So transporting soiled instruments promptly helps minimize microbial growth and prevents cross-contamination in patient care areas. We have to make sure we are handling them safely. So proper transport procedures reduce the risk of staff exposure to any bioburden or pathogens and any other infectious materials. It also will help protect the environment. So using designated transport methods prevents contamination of the hallways, the elevators, and any other patient care areas. Remember, when we're moving contaminated instruments or equipment through the hospital, we got to make sure it's safe. Patients there are already sick. We don't want to hinder their healing process by exposing them to any of um, our dirty instruments or our dirty um, e- equipment as we're moving around the facility. Maintains workflow. Efficient transport ensures that instruments reach um, SPD without delay. So it supports the cleaning, the decontamination, and the sterilization process. The longer we hold it up, or they hold it up onto the floor, the longer it's going to take us to process. Regulatory compliance. Following regulatory recommended um, transport procedures aligns with OSHA, CDC, the Joint Commission. So it's just safety all around. Transporting soiled items safely is critical to prevent exposure to infectious materials and to prevent both staff and patients, or I should say, protect both staff and patients. Make sure they're in an enclosed and leak-resistant container or cart to ensure that contaminants do not escape during transport. Sometimes you'll see those red biohazard um, containers. Those are a proper container that we can use. The cart, make sure it is closed. Make sure we can close it with doors, or if we don't have one, we cover it with some type of covering to make sure the contaminants stay within in that cart. Proper handling with biohazard symbols clearly communicates the risk of contamination to anyone handling or coming near these items. Do not overfill any of these containers at all. Don't even overfill your cart, because the results can be in the spills, especially if some of these containers have any type of liquid in it. It could spill. Sharps. Remember, some of these instrumentations are sharp. We don't want our people to get hurt or get punctured with a sharp instrument. And it's just staff strain. Some of these instruments are heavy. We don't want to strain our own employees and hurt them while they're trying to empty these carts. So always maintain a manageable load. Make sure the transport routes are planned to avoid a lot of areas where there's high foot traffic and patient contact. Um, we'd want, like I said, we want to reduce that risk of contamination. The less likelihood we are traveling where patients are at, the less likelihood we will contaminate them. We must follow the facility's PPE protocol. So make sure, like I said, it's mostly gloves. If you need to have eye protection, have I've never seen a gown worn. I don't think I would wear a gown unless I can dispose of it at the point of use. Um, Sometimes you might want to wear a mask. So whatever you're comfortable with in your PPE, mostly it's just gloves. Um, any spills that occur during transport must be immediately contained and disinfected according to the facility procedures to maintain safety and compliance. If you spill in anything on your route from point of use to the decontamination area, I would say stay there. Let's get um, the environmental services people involved so they can get it cleaned up immediately. Safety for the patients is first. Um, in the offsite processing, that is a critical component in the sterile processing workflow, especially when in-house compatibilities are limited or unavailable. So the soil levels. Proper assessment of soil levels is essential to determine the appropriate cleaning and sterilization methods. Instruments with heavy contamination may require more intensive cleaning procedures. I've never been at a offsite processing. I know there is some out there. Um, I've heard um, that they take their processing very seriously. They go actually above and beyond what is done in facilities as well. So they take whatever the IFU says to the T, to the letter. They will not deviate off of that IFU no matter what. Packaging. Instruments should be securely packaged to prevent any exposure to environmental contaminants during transport. So this could be using any appropriate containers and ensuring that the seals are intact. Remember, we don't want those instruments to spill. We don't want that fluid, if they're in some type of fluid, to spill. The transport conditions. Maintaining optimal transport condition is critical to prevent damage or the degrade, degradation of instruments. So this can include controlling the temperature, humidity, and physical handling during transport. Remember, optimal time for these microorganisms to fester, to start multiplying. We don't want it too hot. We don't want the humidity too high, stuff like that. So we're trying to keep it cool as possible. In the documentation, we need to make sure implementing a robust tracking system allows for real-time monitoring of instruments, ensuring accountability and traceability throughout the off-site process. So we might use those tracking systems so we can see where our instruments are at in that process. The regulatory compliance, it's imperative to adhere to industry standards and guidelines, especially those that are set by AMI and HSPPA, which is the Healthcare Sterile Processing Association. That's who we go through. And also, don't forget the CDC, infection control, whatever. So it's all to ensure the safety and efficiency of process instruments. Um, Effective education and training are critical in sterile processing to maintain high standards of infection control and patient safety. The primary goal is to ensure that all staff are proficient in the decontamination process, which is vital for the safety of patients and healthcare workers. We want to make sure that when you're working in decontamination in the decontam process, that you are proficient in what you are doing. So we want to train you effectively. We want to make sure that the education is there. Um, like I said, these instrumentations are expensive. You can actually damage the instruments if you're not cleaning them properly. You can put um, your own coworkers at risk if you're not cleaning these properly. So the education, training, and decontamination is one of the most critical things that we can do to help you in your career as an SPD technician. The standard operating procedures, or the SOPs, it is a clear written instructions for all the decontamination tasks. Hands-on demonstrations. A lot of people, me included, don't give me something to read and say go for it. It's not going to happen. I'm not a reading type person. Don't give me something to read and say, do you understand it? No, I'm the hands-on. I like to see it actually done. I like to do it myself. So with hands-on, and a lot of people learn this way too. Allows the staff to practice the procedures under supervision to reinforce learning. I like to, when I train someone in decontam, usually the first day or the first half of the day as I'm training them, they're watching me. They're seeing how I do things. Um, then I will switch it around. I'm watching them to making sure that they're doing it correctly. So you are going to get your hands dirty if you're with me. I will make sure you get in there and start working with the the process. Competencies assessments. So competencies will evaluate the staff proficiency regularly to identify areas needing improvement. Competencies is our everyday thing. We do that. We do competencies practically either 1 to 2 years. You are doing your competencies. This is just to ensure that you know what you're doing. Ensures um, that when you are by yourself and then you keep making mistakes, the same mistake, we can say, hey, we've trained you. You've done the competencies. You know what you're doing. Why are you messing up? Do you need more educational time? Do we need to reevaluate, train you? So competencies is important. Ongoing education. Uh, it is critical for us for ongoing education. It offers continuous learning opportunities to keep staff updated on best practices and new technologies. Yes, you might heard the same things over and over and over again, but things can change. I've been doing this for a long time and I've seen how it has changed throughout the years. So the ongoing education is not a waste of time. Training areas. This is to focus on critical areas such as point of use treatment, the transport protocols, the decontamination procedures to ensure comprehensive staff competence. Documentation. We have to maintain detailed records of all training activities, including SOPs, competence evaluations, and continuing education to comply with regulatory requirements and facility audits. Let me tell you, that is such a true statement. The facility audits. Um, Joint Commission is good for that. I've seen it. They've done it to me. So when they come and they want to see if you've been trained properly, they will look into your records. Regulatory compliance. It ensures that the training programs align with industry standards and guidelines to meet any of the accreditation and the regulatory expectations. So in conclusion, the point of use treatment is to emphasize that immediate treatment of soiled instruments at the point of use reduces bioburden, making so making the cleaning and the sterilization more effective. It highlights that staff should follow facility protocols for rinsing, wiping, and soaking these instruments. We have to make sure that we can explain that transporting contaminated items are safely protects both staff and other areas of the facility from exposure to any infectious materials. We have to make sure that the importance of using enclosed carts and the biohazard labeling is in fact. We have to make sure that the workflow efficiency, make sure that having a designated holding area and organized transport routes to the decontamination. Um, it, it also will reduce the delay and maintains the instrument availability for any surgical procedures. So the more time we have it stays in the decontamination area, the less time it's going to be on the clean side to be assembled and processed for the next patient. So the more time we spend cleaning it, we're holding it up for the next patient. So that's not patient safety. Compliance and standards. We have to make sure we follow the established guidelines from any of the organizations and manufacturers to prevent any damage to these instruments. We have to make sure the patients are safe. We have to make sure our own staff is safe. And we have to make sure we maintain the regulatory compliance. So, the combination of proper point of use treatment and secure transport forms the foundation for effective decontamination and supports the overall sterile processing workflow. Uh, Make sure you do your practice exercises, which is in your workbook. It's on page 27. I don't really need to see that. That's just for your retention of what you've learned, not just from the PowerPoint, but from what you've read. Your review quiz is on page 27. Do your review quiz. You have the answers in the back of your book. Check your own answers. Please do not cheat. Cheating only hinders you, does not help you. And record your score either through ThinkWave or email me your quiz scores so I can properly record them into ThinkWave myself. This is my contact information. If you need to get a hold of me, please do not hesitate. I will try to answer any questions or help you at any time to the best of my ability. Thank you for going through this, and hopefully you have now grasped what point of use processing is. Just remember, point of use processing is where the instrumentation is coming from. Thank you.